Nutritional considerations for patients undergoing chemotherapy and radiation treatment. Hi, I'm Dr. James Meschino. There's a lot of controversy about what diet and supplements should be used when people are undergoing chemotherapy treatment or radiation treatment for cancer. Many oncologists will say it doesn't matter what you eat, it's not going to have an effect. And they will discourage you from taking supplements because they'll claim it might interfere with the treatment that they're giving. But the evidence actually suggests otherwise. It shows that certain dietary practices and certain supplements can actually enhance the efficacy of cancer treatments, enhance the killing effects of chemotherapy and radiation. Also, supplements can help to prevent damage to your immune system by chemo and radiation. I will tell you something, you need your immune system because once the radiation's done, chemo's done, there's probably going to be some cancer cells that are still lingering about. Rarely do they get all of them. You're going to need your own immune system to hunt those remaining cancer cells down and kill them. And also, supplements have been shown to decrease some of the common side effects that people get when they have chemo and radiation, like mouth ulcers and inflammation. We call that stomatitis, and gastritis in the intestinal tract with nausea and vomiting, loss of appetite. Some certain supplements can help to reduce the likelihood that will happen. So as the Director of Nutritional Therapy at the Canadian Cancer Immunotherapy Centre in Toronto, where I work with an integrative medical doctor, let me tell you what my protocol is for patients that are receiving a radiation and chemotherapy treatment. First of all, I put them on a low animal fat diet. Why? Because other than fish, other animal products that are high in fat have a fat called arachidonic acid. And cancer cells convert arachidonic acid into prostaglandin series 2. And when they do that, the cancer cell divides at a faster rate. So I need to stop feeding the cancer cell the raw materials that are helping the cancer cell grow. So you can't eat high animal fat foods. And the same is true for certain vegetable oils like corn oil, sunflower seed oil, and safflower seed oil. Also, you need to be on a low glycemic diet. Cancer cells feed on blood sugar, which is glucose. Your day-to-day and hour-by-hour glucose level has to be kept very low. In fact, there's a very specific type of cancer-killing, a very low glucose diet that also raises ketone levels that's been shown to actually starve cancer cells to death and do a very good job of inhibiting the spread of cancer, can actually cause regression in cancer. But it's complicated to explain, and that type of diet requires physician monitoring 2 or 3 times a week, so I can't explain it all right here. But in one-on-one sessions with my patients, I walk them through it because we can monitor them in the clinic. Other nutrients like cruciferous vegetables also help cancer cells commit suicide on their own. That needs to be part of the dietary plan of every cancer patient. Then there are supplements. What's the goal of supplementation during chemo and radiation? Number one, you don't want to interfere with the treatment. So you have to take supplements that are not going to interfere with what the oncologist is doing. I understand that. But you also need nutrients that will help keep your immune system in the fight. That's vitally important. And things that have been proven to decrease the side effects of chemo so you don't lose as much weight, you don't have nausea, you're not vomiting, you don't have stomach ulcers and mouth ulcers. There are things you can do to guard against that nutritionally. So I like to give the person, first of all, immune modulating supplements. They are medicinal mushrooms and astragalus. In fact, astragalus has been shown to actually help bring your white blood cell count back up very quickly after chemo and radiation, which usually causes the white blood cell count to drop. That's a very dangerous situation. Also, you need to protect your liver with milk thistle and the indole 3-carbinol. The indole 3-carbinol from cruciferous vegetables also helps cancer cells commit suicide. So that's spectacularly good. So I give patients a combination supplement with milk thistle, the indole 3-carbinol, astragalus, and reishi mushroom extract all in one. And I also get them to go to mushroomharvest.com and order the 14 mushroom blend and have 2 teaspoons a day. That's about 4 grams of medicinal mushrooms. That's the therapeutic dose that's useful. Then I add an herb called Chinese skullcap. It contains a flavonoid called the bacilline flavonoid. It has many anti-cancer properties that work synergistically with chemo and radiation to help kill cancer cells. And I put patients on a combination of curcumin, boswellia, white willow bark extract, and ginger. Why? They work together to block the ability of the cancer cell to make prostaglandin series 2. If the cancer cell can't make prostaglandin series 2, you're going to slow down the rate at which the cancer cell is dividing. The chemo and radiation is going to work better and knock those cells out. They can't run as fast. Curcumin also slows down the rate of cell division by inhibiting what's called nuclear factor kappa beta. I know it's a big word, but I want you to know that I know what I'm talking about. I also give patients an essential fatty acid supplement with fish oil, flaxseed, and borage seed oil all in one. They take 4 to 6 capsules a day. It helps the cells make more prostaglandin series 1 and series 3. That slows down the rate of cell division, also blocks the formation of dangerous prostaglandin series 2. I put patients on 5,000 to 10,000 IUs of vitamin D at least, because it slows down the proliferation of certain cancer cells, forces them to mature into more adult, normal-looking cells, has great immune modulation effects as well. I get the patients on L-glutamine. It's a supplement that's been shown to protect the immune system and the intestinal tract as well, so that you don't get the stomach ulcers and the mouth ulcers and the nausea and the vomiting and the loss of appetite. L-glutamine at a specific dose can be very useful in guarding against side effects from chemo and radiation. Then the last one is antioxidants. Now there's controversy. Some experts feel that taking antioxidants might block the killing effects of chemo and radiation, but the review papers by Dr. Keith Block, who's a famous cancer doctor, medical doctor, and also Dr. Kenneth Conklin in the journal called Nutrition and Cancer, reviewing the research shows that actually adding antioxidant supplements enhances the killing effect of many chemo drugs and radiation. You have to remember something, that most chemo drugs can only work if cancer cells are trying to divide, because they do certain things to block certain steps as cancer cells are dividing so that they can't divide and they eventually will commit suicide. But though the side effect of many chemo drugs is that they generate tons of free radicals. When the cancer cell sees there's a lot of free radicals around, it doesn't even try to divide. It waits for all the chemo to go away, then it starts dividing again. If the antioxidants are there to mop up all of the free radicals induced by these toxic chemotherapy drugs, then the cancer cell thinks it's safe to come out and play, so it tries to divide, and that's when the chemo drugs work the best. And that's why the studies have shown that giving people antioxidants with chemo, most chemo drugs, is useful, and we also saw the same thing when patients were getting radiation treatment. So this is where the level of evidence is right now. What I'd suggest you do is click on the link below and see my research paper on all of this, as well as the nutrition supplementation protocol that's appropriate for cancer patients after treatment is over to help reduce the recurrence of cancer. What you will see in my article are all the scientific references on each of the nutrients that I talk about, so you can evaluate the information for yourself. Now remember that at meschinohealth.com, you'll see my other research review papers, you'll see footage from my live professional seminars, you'll see other downloads, resources, and videos I've created. They're all there to help you lead a long, healthy, functional life. My research review papers and teaching materials are complete with all the scientific references, so you'll know you're getting only evidence-based information from me on any health topic that you're looking for. So you should use meschinohealth.com as an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.